Welcome back to the show, ladies. Today is someone who wears many hats. She's a physician, she's a mother, she's a fierce mental health advocate. I have Dr. Lynnette Staplefoot here, who is currently completing her dual residency training in internal medicine and psychiatry with a special interest in perinatal mental health. She's going to be talking about her own story. Her passion for perinatal mental health doesn't just come from textbooks, it comes from her personal experience. Dr. Lynnette faced preeclampsia not once, but twice. First, during pregnancy, and secondly, after. She had to navigate all the physical and emotional changes that her body went through with high risk pregnancies, but still maintained her cool. Her journey through motherhood and medicine gives her a rare and powerful perspective about the gaps in postpartum care and what really needs to change. In this episode, we're going to talk about what it's like for her to be a patient and maybe a little bit about how it's like for her to be a provider as well. Her trauma, her experiences has shaped her purpose and what comprehensive care looks like for moms. Whether you're a clinician, whether you're a mom, whether you are just somebody interested in this topic, this conversation is for you. Bessie, thanks for coming on the show. And I'll tell you guys, I keep going back between Bessie and Lynnette because me and Lynnette go way back. We've known each other probably since fourth grade. No, was it fifth grade, sixth grade? Something
I think
like
like
that.
the first like middle school
Middle
time.
school.
Yeah.
So we like to flip back and forth between our names. I'm Pendula, sometimes I'm Erica. So she's
Brad
Bessie.
might slip up too.
So
So
But I'm so happy you decided to come on the show and share your story. I applaud it when moms can really just share what happened because we overcome so much by sharing our stories. And so thank you for coming on today.
thank you so much for having me, Pindy.
Yes. Tell us a little bit about your pregnancy. Talk about your first one. What was it
Yeah.
like for you?
Yeah. So my first pregnancy, I was just about to turn 30. But then not only a big milestone and a birthday, I was also about to start medical school.
Mm,
My life that year, that 30th year, was just a lot going on. Daniel and I learned that I was pregnant a few months after I learned I got into medical school. So there was a lot of changes that were going on that year.
mm,
And it was a really happy time, right? It was a happy time, but it was a lot of transition, many different stressors all at
mm,
once, multiple life-changing stressors going on. So having to move from medical school, going to medical school, changing careers, having a new baby, that was just a lot. I think
mm.
at that time I was excited, but I did not appreciate how many different stressors all at once are going to
Right.
happen to me and how life-changing it would be. So at that time, I had a view of how I wanted my pregnancy and my
Mhm,
delivery to go. This was before medicine, so I was a little, I would have to say crunchy granola at that time, right?
mhm,
So to, I was a person, I wanted I wanted the birth at a birthing center. I wanted
mhm,
to be in the pool and have my delivery in a pool, no pain medications. I wanted the midwife. I wanted the essential oils and candles. I
mm.
wanted the whole natural
Birth
situation, right?
experience. Yeah.
Exactly. And then also, in addition to that I wasn't quite sure how I wanted my prenatal care to go. So at first, I was being taken care of by a family medicine who also did and
Obi.
delivered babies. One of the things that I didn't maybe appreciate at that time was understanding how often a provider actually delivers kids and provides prenatal care. I don't think
Right.
this particular provider had many
Mm,
deliveries. So there were a lot of little things that when I look back and with my second child and actually going to OB-GYN who was experienced with this,
mm,
realized at that time maybe the family medicine practitioner who didn't necessarily have as much experience with delivering kids maybe missed or didn't counsel me as
right.
possible. So I think that first birth brought a lot of different stressors,
Mm,
maybe inexperience with the type of provider or care that I should have, what I want my birth to be, maybe. My little one actually was born early,
mm,
31 weeks, a week and a half after my birthday. We were expecting him in May, but he came in
mm,
March. it was a huge shock coming from having the expectations of being in a birthing center in a
Yeah.
tub with essential oils, no pain medications,
Yeah.
to literally having to be in a hospital and having a C-section. It was obviously completely different than what I
Yeah.
was expecting. One of the things that prepared me, a mutual friend of ours, Beth, I spoke with her on the phone. She had her first child. I think she was pregnant with her second child at that time. I was asking her for advice. She gave me really good advice that I didn't get from a lot of other people. And she sat me down. She's Lynette. I hear your birthing plans, and I think that's beautiful. But she's also be okay with the
Mm.
unexpected and, and it not going the way that you want. And
Mm.
she shared with me her expectations for her birth. And because of medical complications, she had to get a C-section, an emergent C-section, something that she wasn't expecting. It really dampened her birthing experience. She said to me, I don't want to scare you, but I want you to have a heart and a mind that's open to something that may not be what you expected.
You are going through your pregnancy and everything is good. You have your birth plan. You want to give birth in a birth center, in a water
Right.
birth. You have a clinician who is supporting that. Your family doctor
Right.
is supporting this plan for you to deliver in the birthing center. Everything is
Right.
great. You have your birth plan. And
Right.
this conversation with Beth, and she tells you this. How did that conversation make you feel when you're talking with Beth and she's giving you this advice? Did you feel like it helped prepare you? Or did you feel defensive about it at that time? Because that information can hit differently with moms. Sometimes
Right.
we're really gun ho about our plan and what we want to do. And how did that advice fall on your ears?
Yeah. I think that's a really important question because as mothers who've been there, done that, as they talk to who are who are pregnant or like going through things, it's really helpful to know how to talk to moms about this hard information.
Mm.
But my friend Beth, I think she was really, it hit well because number one, she said it in love,
Mm.
right? It came from a good place. She listened to me and I told her my whole growth plan, right? And she's
Mm.
actually, I think that's really wonderful. And I think that's beautiful. And I hope that you have that experience. But do you mind if I share what happened to me?
Mm.
And I think she asked me, is it okay if I share? I don't want to scare you, but I just want to make sure you're prepared. And so I think the fact that she said it in love, made
Mm.
sure I was ready to hear it, right? And just gave me her experience without trying to scare, but also sharing her feelings and that she was afraid, but then also
Mm.
that if she was more mentally prepared for it, she might have been able to handle it differently.
Mm.
And that's why she wanted to share it with me to say, hey, I just wanted to give you, she let me know, okay, an anesthesiologist may come in and they will do a epidural, and it might be a little scary when you have to get a needle stuck in your back. Just different things, just preparing me for those things. And actually, at that time, it made me a little nervous, but
Yeah.
then also I'm like, oh, that would never happen to me, but at least I know. And when the time came when I delivered, I actually had to get a C-section.
Yeah.
But,
Did you
and
go
the
into
things
labor,
that,
Lynette? Walk me through when you, because you said you
oh, yeah,
delivered at 31 weeks. Did you go into clinic and something happened, and then that's how your doctors determined you needed to deliver early? Walk me through that process of now
yeah. So let
needing.
me tell you how that happened. At that time, Daniel and I, we were very religious in reading
Hmm.
our What to Expect books. One of the things at 28 weeks, it talked about early delivery and the
Hmm.
things that would contribute to that, right?
Hmm.
And I think that was really wise that the book put that in there. And one of the things that was mentioned was preeclampsia and different things that could contribute to an early delivery, right? I read that and I was okay, this is not going to happen to me. But I say, was this God? I don't know what it was, but a few weeks later, after I read that thing in the book, I started reading a little bit more about preeclampsia. What are the signs? One of the biggest things was a headache, worst headache in your life, or
Hmm.
swelling. And I was starting to experience that. And I was, oh, this is just regular pregnancy. But I was experiencing the swelling. It was harder for me to walk and do the things that I normally could do. And so I was noticing those signs. And as I was reading more about preeclampsia, I think I was on the March of Dimes website.
Hmm.
I was like, these things are happening to me, but maybe it's okay. That very night when I went to sleep, I woke up with the worst headache in my life, worst headache. And I was like, oh my gosh, I don't typically get headaches. This is like terrible. I woke up Danielle and I was like, babe, I think I need to go to the hospital.
Mm.
So it was me, right? Like at that time, I was in between clinicians. I was seeing my
Family
doctor,
doctor.
but since I was wanting to go to the birthing center, I was also getting joint care with and I
Therapy.
think, yeah, it's funny because the visit the week before everything went down, I didn't get vitals or
Mm.
the urine test that you like typically should get, right? To see if you
Why?
have
What happened
either
then?
UTI. I just didn't get it. They just didn't collect it that visit,
They didn't get your vitals in
And
clinic.
yeah, isn't that interesting? And that's like a red flag. Every visit, you're supposed to at least give urine, at least vitals, right? So, anyways, so obviously that wasn't caught during of actual visit, but it was caught when I listened to my body. It was like something's not right. So I went to the hospital. Daniel took me to the hospital,
Mm.
and lo and behold, I had the protein in my urine. And they're just like, okay, you have the worst headache in your life. I saw the floaters and everything. And they were like, yeah, you have preeclampsia.
Mm.
I was admitted. And so originally it was like, okay, perhaps like if we can get your blood pressure better controlled, we could potentially hold things off. But obviously that didn't pan out for me, right? There
Mm.
were signs that I had more severe features. And so it was necessary for me to deliver. So the
Mm.
plan was for me to have a vaginal birth. They did induce labor, but because a little guy didn't tolerate that, the decision was made to have a C-section.
How are you feeling, Lynette, at that time? You're going through this, you have to go to the hospital, things are moving really fast. You attempt to do a
Yeah.
vaginal delivery, and then now you have to be rushed to get a C-section. What are you going through at this time?
Yeah. It was definitely scary, of course. And it was also surreal, right?
Yeah.
I think one of the things that many women feel that may have like fast moving things happen in their pregnancy that may not be something they were expecting is that a lot of times like decisions are like made to spite you, right?
Yeah.
And I think that's what it was. It was just like, okay, I got to do what I got to do to
Yeah.
make sure baby's safe. I'm safe. I don't really know. Like, I'm not the doctor here. This was before medical school, but I don't really know. So I have to trust what my provider is saying. But yeah, it was disappointing. One of the things I do remember was like during that process when they said I had to have a C-section, I remembered Beth's conversation.
Mm.
I heard Beth calmly talking to me about her experience.
Yeah.
And when things were happening, I was like, Beth told me this. Relax, deep breathe. You know what's happening next. When I look back, I'm so grateful that someone talked to me about the possible worst case scenario.
Mm.
Because when I was going through that, I felt a little bit more prepared,
At
right? Because
ease.
I know what is happening, right? To me. Daniel was very stressed, my
Yeah.
husband, and I think I was I felt stressed out for him, right? Because
Mhm.
I'm thinking things are going great, but my wife and my unborn child potentially are in peril right now.
Right.
So having that burden of wanting to be calm for him,
Mm.
but seeing that he was worried was hard too.
That's hard for your family to see you in that place. And I'm sure you both
Yeah.
had gone over what that experience was going to be like and romanticized having kids. And now it's a completely different situation. And that impacts you. How did that sort of change your postpartum course? Because I'm assuming baby had to now be in the NICU. And so not only is your birth plan different, but now your postpartum reality is completely different. How did you manage postpartum with this birth experience that you
Yeah.
had?
Oh yeah. Extreme. First of all, it was extremely complicated postpartum
Yeah, I'm sure.
course. Not so there was a NICU course that
Mm.
was tricky, but then we had plans of moving for medical
For
school, right?
school.
And so our plans actually move before he got here. So
Mm.
like the time that he came was actually the time that we allotted. to do all our moving and get everything settled. He came in the middle of that, but then we also still have these plans of moving to a different city. So it was extremely complicated. Since he was born early, there's like a protocol where like baby has to be in their incubator to
Mm.
reduce the risk of intracranial bleeding. They cannot be held, right?
Yes.
Like they have to just be still
You have to
in
watch
this
some.
incubator.
Mm.
And I think at that time it was like 72 hours, I think. And so can you imagine the baby you birth you cannot hold
Mm.
for the first days of their life?
Or
Really
even
hard.
breastfeed.
Anyone who has been on magnesium knows that maybe magnesium causes you to be a little different than your norm, being a little drowsy and having a lactation consultant be like, girl, you better start pumping, get some pumping. I was like so hard not
Yeah.
having my baby, having to pump at this machine. And then also being told breast milk is the best. And if they get formula, there's a higher risk for complications as you're trying to like recover from a C-section. You're also
Mm.
getting medicine that is like not allowing you to be at your best cognitively and physically. And then navigating normal.
Physical and emotional changes after birth. There's a lot of pressure on moms. You put a lot of pressure on yourself about how birth should look and probably romanticize what postpartum would look like for you and your family. And then now you give birth, you have a C-section. Now your child is in the intensive care unit and you can't breastfeed right away. You can't hold the baby. You have pressure to pump to produce breast milk for your baby. And so now you have the pressure of being a good mom, the pressure to
Right.
bounce back. How are you staying grounded at this time? How is your mental health during this process?
I do remember either day one or day two postpartum, there was a day that I literally was just like, dang, this is a lot, and was just like bawling. I just remember like, what in the heck? What is happening? And I think that's like obviously a mixture of all that was going on, but also a shift in hormones, right? And my mom was by my side the
Oh,
whole time. And I remember her just giving me a tissue, helping me clean up with my mom was a nurse.
yeah.
So this was very normal for her, like second nature. And just
Mm,
her, she didn't necessarily tell me everything was going to be okay or tell me, oh, don't cry or blah, blah, blah. She just cared for me. She was that wonderful presence,
yeah,
making sure that I cared for myself.
absolutely.
Like a mommy, like it's like it's she was being my mommy, right?
Yeah, yeah. No,
And
it's
just
good.
having, yeah, like having that, like having her there to take care of me
Mm,
while I'm trying to take care of everything else, like my baby,
absolutely.
and then also this future plans of going into medicine. It was really a blessing to have my mom there.
Yeah, the
Yeah.
power of
So,
support. I think a lot of people don't always have that. And so you have to
yeah.
having that person by your side. Our society is so independent. I have sometimes families who literally their parents are down the street and you're just like, are you gonna get your mom? But you want to be like,
Right.
I could do it by myself. No, you got to pull in the resources. It sounds like you had that support of family to be able to just hold your hand, which is very important when you're going through moments like this, for sure.
So mom was there,
Yeah.
but then I also another mutual friend of ours, Yvonne and Marla, they actually came
Oh,
from,
wow.
yeah. So they flew in. They were planning on coming in May, but obviously he came early, so they were able to come
Right.
down and number one, help me like with like, other stuff like transitioning to
Mhm.
another city, but also with the shifts with Josiah in the NICU.
Oh,
When I couldn't be there, they were
mm,
there. Daniel's parents came down too and helped out with those shifts
mm.
so that it really took a village, right? It
Yeah,
took a village to get little Josiah through, but get us as parents through. And
absolutely.
I think humans were built for that, right? Like I think
Absolutely.
that's really actually how we're supposed to function as a village.
Absolutely. I know you ended up having baby number two, and with the experiences that you went through with baby number one, how did your approach change, whether through pregnancy and with postpartum? How did the lessons of baby number one change?
Our baby number two, I maybe did a little bit extra with all the planning,
Mm,
but the approach that I took was I'm going to control the things that I can control
mm,
because there's going to be a lot of things that I cannot necessarily control, but
mm,
let's try to bring that down, those variables down as much as possible. So with Josiah, my first, after the pregnancy, I do think I had a little period of increased depressive symptoms and anxiety.
mm.
And so me knowing that about myself, I
Yeah.
was like, okay, what am I going to do to prepare my heart, mind, and everything for that, right?
Yes.
So one of the things I did was get therapy. I was in medical school at that time and therapy was offered. It was like that was something that we got as a part of just being in the school. I didn't have to pay for
Good.
it. And so I was like, okay, I think probably like maybe either once I learned I got pregnant or as I was getting pregnant, like in the process of getting
Mm,
pregnant, I got a therapist
good.
and made that a priority. And then also, I chose OB-GYN that number one, I felt comfortable with. And
Yeah.
I'll just be honest, this is not something that has to be for everyone, but I wanted a Black woman. But then also before I even got pregnant, I did pre-conception like visit, right? So like talking, like I talked to my OB-GYN, like what are some of the things that we need to think about to reduce risk? And I told her my history. I told her like, hey, I'm in medical school. Like I can't really afford like a whole bunch of, I guess I want to make sure that my pregnancy is optimized and I'm doing all
Right.
the evidence-based things
Yeah.
that can prevent any like future risk.
Yeah.
And I want to do that even before I conceived, right? So
Good.
that was one thing
Yeah,
that I
that's
did.
so
So
proactive.
have a provider, yeah, a provider that I was comfortable with. Having therapy. And then
Mm,
also my provider was like, okay, you want to do all these things, blah, blah, blah. Yeah, you're at risk for preeclampsia again. That's just like the nature of it. But
nature.
these
Right.
are some things that you can do, right? It is very important that you exercise. There was a study for pregnant moms to exercise during pregnancy.
Mm,
And what the study was looking at the outcomes for the baby. But part of it was that you had to exercise 3 times a
mm,
week as a part of the study. I had that accountability. I had a
mm.
little personal trainer who made sure my heart rate was at a certain time the whole time. So it's
Wow.
like I actually had to exercise 3 days a week throughout the whole pregnancy. I
Mm,
had therapy. And then I also engaged at that time, you can consider it an employer, but my medical school. So,
yeah.
like, they knew that I was pregnant and like the timeline, and we came up with contingency plans.
Mm,
All this is how much time you have off, and this is what's going to happen if this happens. So, I think making sure that your support, I like built up my supports, right? So, built up my supports with a therapist, built up my supports with a provider I felt comfortable with,
mm,
being transparent with my school, and made sure I understood the policies that protected me,
good.
but then also, like trying to be realistic with them to be like, okay, I need a certain amount of time off. I can't be doing certain rotations. And then also, like I talked to my other supports, right?
Mm.
Who part of the family who's going to be able to come and help out. So yeah, I
I
think
love that. I think that's really important. I try to have this conversation when I have events and I tell moms about postpartum planning. There's all this
right,
planning that we do on getting the right crib and getting all the right things. And I think a lot of moms could get in front of it. First time moms were literally worried about the onesie, the magical birthing experience, and the music we're going to play in
right,
the room. What you did for baby number two is how I wish we all would approach baby number one. Let me do
right.
some planning. Let me get my body right before I get pregnant. Let me nourish my body during the pregnancy. Do all the planning in advance because I know either that last trimester, the childbirth, or the postpartum may be a whirlwind. How can I prepare my mind, body, and soul? And so more of that needs to happen. And the fact that you had the wisdom to do that and nobody helped you do that, I think it just speaks to a lot because I don't think a lot of us necessarily create that space to figure out, okay, like how can I do this different? I would hope that our professionals and everybody around us would give us those prompts, but I'm just happy that
Oh
you
yeah.
did that.
I try to do that for the people I serve as well, but
Good.
it definitely comes from experience. Yeah.
Mm. If you had to build a system or a model of postpartum care,
I think postpartum care starts with proactive peripartum. antenatal care. And so I think part of postpartum care is not only think about having a birth plan,
Mm.
right? Having a postpartum plan. Who's gonna do night feedings? How are we gonna structure things in the household to make sure mom gets sleep? Who's gonna be around? Who's like the trusted person or people? They're gonna help like not only just hold baby and see how cute they are, but like freaking like cook, fold clothes, or
Right.
do things around the house. That's kind of tricky, right? I think it would be helpful for providers
Mhm.
or people around, like a therapist or whatever,
Yeah,
or doula
lactation
to help.
consultants, everybody
Yeah,
who's around
lactation.
mom.
Yeah, everyone around mom to help them think about that
Yeah,
and unload the cognitive load, right?
yeah,
But then also, I think we should have checkups for moms like before like the 6 week.
I know.
Oh, the
It's
6 week mark.
terrible.
There's so many things that could happen in those 6 weeks, and our healthcare system isn't set up to accommodate that. But I think it would be helpful.
We can change it. How has being both a patient and a provider changed how you show up for moms and how you plan to show up in the future for moms?
I think for me, it changes the way I show up for my friends who are going through childbirth, right? So,
Mm.
as someone that gets extremely busy, right? So, I have children in a residency program. You don't really have a lot of time to do extra things, but I am very intentional about focusing on. I tend to personally, right now in my life, I tend to try to support moms, whatever their feeding plans are. So
Yes.
if you plan to, pump or do formula feeding, whatever I can do to support that aspect, that's what I try to do for all my friends.
Girl,
Yeah, right.
that is
So I kind
huge.
of
That is
focus on that. Right.
that is huge
Yeah.
because eating,
Yeah.
ooh, the
Right.
perceived failure from either formula, breastfeeding, whichever spectrum, that can send you
Right.
into
Right.
depression by itself.
Exactly. Exactly. So like my whatever I talk to family or friends, that's the
Mm.
thing. I'm like, okay, what breast pump are you gonna use? I can buy you supplies or
Oh,
what formula do you want? Okay, I'll send you that. When it comes to feeding, that's what I actually have time for right now. And I'm just
yeah.
like try to be intentional. And I know that is really important. I want to keep the baby
No,
alive.
that's mental health. I'm sorry. That's
Right.
impactful. If you had to give three pieces of advice for someone who's listening today, what would you tell them?
One thing I would say is this too shall pass. Okay. So that's like the negative aspects or like things
Mhm.
that are hard. But then it's also the case for the
Mm,
good things, right?
mm,
So when I say that, I think it's helpful for moms to be in the moment, try to be in the moment,
mm,
savor those good times, and try to be at peace even with the negative times,
mm.
knowing that this too shall pass.
Absolutely.
And then second piece of advice is be okay with leaning on your village. Yeah. And then the third thing is take care of you so that you can take care of little one.
Thank you so
Yeah.
much. Thank
Yeah.
you. Thank you for coming on the show.
Yeah.
I
Thank
don't
you for
know.
having me.
Of course. I don't know if you want people to call you or not. I know you didn't put nothing on there, but if somebody wants to reach you or ask you a question more in depthly, or if they just want to follow you or get in touch, do you give out your information in any way, or should they contact me and I'll forward it to you?
I am on Instagram
Okay.
and I am open for communication there.
Okay, great.
My handle is Bessie's Best MD,
Okay.
and I'll send that to you so you can put it in the show notes.
Bessie
Um,
Best MD.
yes, yeah. So someone can reach out to me there.
Okay, perfect. You take care of those babies, hug them
Yeah.
quick, and definitely continue to use your story, share your story to improve mental health for moms. And I'm really looking forward
Absolutely.
to what you're going to do in the future.
Yes.
Thank
Well,
you.
thank you so much. Take care,
Take
Cindy.
care. Bye.
Bye.
Are you navigating pregnancy and postpartum alone? Are you feeling overwhelmed by the lack of support? You're not alone, and you don't have to do this alone. With EM Care to You, I offer personalized in home and telemedicine support designed to guide moms through the challenges of the postpartum period. Whether you need total on call services or periodic check ins in the home, I help women recognize warning signs, and I support you as your advocate, and I am here for you the entire step of the way. I want to create a postpartum plan that's all about you, your health, and your recovery. Follow me on Instagram at Dr. Choa for tips, resources, and there you'll find a way to book me. All right? DM me or email me if you have any other questions. Other than that, I'm on all social media platforms under Dr. Choa, DrChowa. Let's build a village of support. Let's give you the hope that you need to get through this period of time. Take care.